Hello, everyone. Again, my name is Esli Reyes, and I will be starting with today's webinar, Flu Outreach and Social Media Strategies for Ag Workers. Next slide, please. So, what are we looking forward to learn after this webinar? We hope that the content that we present today will increase your knowledge on assessing and evaluating current flu vaccination social media efforts and outcomes. We hope that it helps you identify new strategies for increasing ag worker engagement and impact through tailored flu vaccination, social media messaging, and cross-promotion with partners, and tailor flu vaccination messaging and cross-promotion with partners as well, and provide access to NCFA social media resources and customizable tools to adapt to your specific efforts and populations. So let's get started. So we're going to begin today with a couple of questions. So you can use your chat box to type these answers. So let's start thinking, why is influenza or the flu important? Have you heard about it? Why do you think it is a big deal? So feel free to type your answers. We're going to give you a couple of seconds for you to give us some of your thoughts, share with us. While you do, we are prepared. So Sylvia, you can reveal the answer. So we know influenza, also known as the flu, is a contagious respiratory illness caused by the influenza virus. It affects our nose, throat, and lungs. It is estimated that tens of millions of people in our country become ill with seasonal influenza, and it results in hundreds of thousands of hospitalizations and even tens of thousands of deaths. So the next question is, Sylvia, we can go. How does it impact special populations, specifically agricultural workers? Do you have any ideas? Again, feel free to put in the chat. But we know, Sylvia, we can click, that ag workers may be more vulnerable than the general population to the flu virus because of their living conditions, their challenges accessing healthcare, and potential communication barriers resulting from language and culture. And we can think about other special and vulnerable populations. They don't have the same access, right? So that's why this influenza can hit them harder and make it more difficult on their health, definitely. So next slide, please. So why do we use social media, and how is it useful for health center outreach? What do you think that? We can reveal the answer, Sylvia. Social media allows organizations such as health centers increase their reach and engagement to promote education, awareness, and call to action among special and vulnerable populations, such as ag workers. So now that we know this, we're going to move forward to start learning a little bit more about some strategies on social media. So next slide, please. Today's webinar is geared by our newest social media toolkit called Flu Outreach and Social Media Toolkit for Agricultural Workers. My colleague Alexis will be sharing the link in the chat box where you can download. This is our third social media toolkit, and later in this presentation, you're going to have access to the other two, so you'll be able to download and have the three for you to refer back. This toolkit supports health centers and other organizations on using social media platforms to share effective messaging about the flu to ag workers and their families. It is designed to assist outreach educators, community health workers, and other staff members in assessing current social media efforts and outcomes, and help identify new opportunities for increasing your patient engagement through tailored social media messaging and cross-promotion with partners. It also offers customizable flu vaccine resources or templates that we will go over later, and you're going to see how you can tailor them and to help your efforts, not only in flu, but in any other health issues that you are addressing. So during this presentation, we will take you through every section in this toolkit table of contents that you can see on your screen, but we're going to do it within a scenario. So let's learn about what this scenario is. So next slide, please. So Here we have Saludes Vida Health Center, which is located in Texas. This is a fictitious scenario, so don't look it up. You might not find it. And they have received a grant to promote awareness of the influenza virus and the importance of vaccination through different educational and outreach activities in their community. Saludes Vida already has 2 social media channels. They have Facebook and they have Twitter. They update them at least once per month, usually only to announce either clinic starts later, earlier, closes later or early. Maybe they showcase when Christmas is coming, Thanksgiving, a couple holidays, and maybe staff birthdays, but that is all. They realized that if they want to increase their reach and awareness of the flu virus, in their community, they have to strengthen their social media presence. So how can they do this? So let's all together help them and learn together through the different steps that they can take so they can expand knowledge in their community about the flu virus and the vaccination. So next slide, please. So we're going to start with assessing and establishing social media efforts. Next slide. So just a quick refresher. I know most of us are familiar with the SMART objectives, also known SMART goals. And it is important to know that setting up expectations for social media efforts can provide a strategic direction to your health center or organization in identifying what steps to take and what social media channels to use to achieve your outreach goals. Establishing goals that are SMART, that are specific, measurable, attainable, and realistic can guide your team while providing a way to evaluate the impact and effectiveness of your social media efforts. So it can let you know if you're in the right path. Once you have a clear set of goals, you're always able to go back, track your performance and metrics, and make tweaks and changes until you achieve your main goal. And revisiting your goals on a regular basis can also help you determine if you're on track again, or if you need something, or if any changes, perhaps partnerships are we're gonna learn on the later presentation. So now we're gonna go to the next slide, and we're gonna go back. We're gonna go back to our scenario. So here again, we have Saludes Vida. So it is important for Saludes Vida to have SMART goals or objectives on what they wish to accomplish through their social media to increase their presence. So we have an example here. Their goal could be they want to grow their Facebook and Twitter following by 10% in the next 3 months by handing out flyers during patients' visits, promoting following their social media. So if we look at this goal, we can see that it's specific, that is measurable, that is attainable, and it is realistic, right? They're using whatever they have already established. They have a percentage of how much they want to grow it. They have a time bound, which is 3 months, and they have the action, how they're going to do it. They're gonna give flyers to the patients that are coming in. They're going to promote their pages because they want more people to follow. So then from here, it's a kickstart. So whatever they're going to start doing is they're going to start promoting, putting educational resources, etc. So SMART objectives or goals can help Saludes Vida increase the brand awareness, increase consumer engagement, and create new opportunities. So how do they do that? We can go up to the next slide, please. So when we think about increasing brand awareness, if we go back to our scenario, Saludes Vida should have established branding, which includes their official logo, colors, font style, their tone. And why is it important? So we can see on our screen, because people would recognize them and become more aware of who they are and the services they provide, including flu services and vaccinations they offer. So we close our eyes and we think about branding. If I tell you a big logo with an M that is yellow, you can probably think about burgers for kids and a clown. So branding is important for people to be able to recognize this health center, right? For people to be able to say, oh, this is a place that I can go and take care of my health needs. So focusing on increasing their brand awareness can help them to increase the brand recognition and reach within the ag worker community. It also increases the ag worker community's access to social and health services, and the number of other community-based organizations looking to join flu prevention efforts and initiatives to create partnerships. So this is important. Branding is important because other organizations can pinpoint. Later in the presentation, I'm going to give some examples on how you can partner with other organizations and how you can benefit both, right? A health center can benefit from a community organization. Maybe a health center has a program on diabetes and you are partnered with an organization that offers healthy eating classes, right? So how can you partner and make a larger impact through social media? We're going to learn as we move forward. So next slide, please. So next is increase consumer engagement. So Salud es Vida should use their social media platforms constantly to interact with followers by sharing health information content. Remember, their goal is flu vaccination. They can do it through publishing posts, images, live events, partnered content, etc. So thinking about what the scenario was. So right now, Salud es Vida is only using it to announce clinic hours, holidays, staff birthdays, but here we need Salud es Vida to start doing some consumer engagement, right? And how does it help? Well, by interacting on social media platforms, you can connect with patients and build community around your organization. And when we think about how all these goals can directly connect to your strategic health center goals, it can also indirectly grow your revenue by attracting new potential patients, which I think is everyone's goal, right? We want more people to come into our clinics and receive services. Also, using publications, tweets, comments, and sharing content can help the ag worker community learn about health center services, learn about information on COVID, on the flu, and other infectious diseases, and access health education resources and other initiatives they can benefit from. So definitely, we want people to not only follow us, but we want to keep engaging with them. We want to keep posts that we want them to like, we want them to answer, we want them to be in the lookout of what else Salud es Vida is posting, right? That engagement. So we're going to move forward to our next slide, please. So how do we do this? We also want to be able to create new partnerships or new opportunities. So Salud es Vida should create partnerships and collaborations that support their cause. Again, flu vaccinations. These networks can expand their reach and maximize local resources for their community. It's important to remember that social media is a great tool to build networks between ag worker communities and healthcare providers, right? It can connect ag workers to new organizations and expand their health access. It also, social media can build community referrals and maximize resources to address social determinants of health, such as housing, transportation, access to healthy food, educational opportunities, etc. Through these platforms, providers can build referral systems with other organizations to address healthcare needs. Like I mentioned, you may have a program on COVID or a program on COVID, and you want to access people are not receiving or are struggling getting to the testing sites. So let me find another organization that I can work with and partner that maybe is helping with transportation, and we're going to start promoting in our social media. So this is how partnerships can help you expand your reach and get to those that maybe we always say when we unite our forces, we're stronger. So on our next slide, we're going to see an example of some social media partnerships. And what I did is I pulled from our own NCFH Facebook page. And this is an example of times that we have partnered with other organizations to share a health message. So here you can see on the first post, you can see that we're promoting the National Immunization Awareness Month, and we're partnering with the Medicare and Medicaid Services and the Office of Minority Health. We're pulling some of their information, we're putting our graphic, we're directing our likers or followers to visit their page, right? And we are also providing this information to the people that are following. So most of us, whether they're health centers or there are our farm worker, we're expanding, we're bringing that information to them. On the post in the middle, we're promoting the National Influenza Vaccination Week. And thinking about Salud Health Center, maybe they can use this one too. And we're partnered with the CDC. right? The same. We're bringing to our followers, to our likers, some information from our partners that can benefit their health as well. And on our last post, we are promoting open enrollment for health coverage and the Affordable Care Act. And we're working with healthcare.gov. And at the same time, this specific post is really nice. I don't know if you're able to see here, but we're promoting the Affordable Care Act. We're giving important links, but we're also promoting some of the resources that as an organization we have developed to support this. We have developed some Affordable Care Act resources, and we're putting it together. So we are crafting the post that to include both parts, whatever our partners are pushing and whatever we're pushing, or what we want at the end is to make a positive impact to the people that are reading it, the people that are following, the people that are liking our pages. So this is a clear example of how we can partner and we can cross-promote with different organizations that support our causes. Maybe your cause is not influenza like Salud es Vida, but what is your cause? You can find other organizations that are walking through a similar path, and that could help you expand your reach and bring this information to the people in your patient that are following you. So we're going to now move to our next slide. So far, we thinking about Salud es Vida Health Center. Remember that we're all together to help them to achieve their goals and strengthen their social media presence. So we know that Salud es Vida has Twitter, has Facebook pages. We already know that they need to set up smart objectives and goals, and this will help them to increase their brand awareness, to increase opportunities, also to increase their engagement. But maybe they need to explore other social media platforms, right? How many are they? So let's learn about it. So let's go back to our scenario in the next slide. So Salud es Vida should explore other possible social media channels to expand their reach. Understanding each social media platform and its potential can help them design their strategies. So they should also take into consideration their target population. For example, if Salud es Vida have a big patient population that are young, then maybe they're not too inclined to using Facebook and Twitter, but they might like TikTok more or Instagram. So it's important. So side note, if you're working in a health center that have a specific population, it's important that you take the time to learning some of their specifics, some of the things that the demographics and what is it that they like, right? What is it that they're using more in their phones, what they work. We have seen that among our workers, some of these platforms are more popular, and we're going to learn about it as we move forward. But always keeping in mind that social media platforms have a unique way of capturing someone's attention, and understanding their individual functions and purpose will help you decide which one to use to connect with your audience, to share information and have a bigger impact on your audience health outcomes. So now we can see here that we have Facebook, we have Twitter, we have Instagram, we have WhatsApp, YouTube, and TikTok. So we go to the next slide. We look at the logos, like branding again. I think this is a perfect example. I don't need to even say their name, only YouTube that you can see it in their logo and TikTok, but you can see, oh, I see the F is Facebook. I see the little bird is Twitter. But each of them, again, have a unique way of helping you reach and expand and promote your message. And I want to refer back to the last link that you see in your chat, which is the Flu Outreach and Social Media Toolkit, because in here, I'm going to give just a few pointers, but the toolkit includes a big section in each where you can learn about the uniqueness of them, the features, what you can do, and how it can help your specific messaging that you want to do and your strategies that you want to implement in social media. So definitely you can refer back to it. But over here, I just want to give some pointers. So we can start with Facebook. We know that Facebook is very popular. It is, at least among the workers, the most popular social media channel. It is great for reading publications. You can share images, you can share videos. You can also do live events, live streaming events. So imagine you have a health fair, you can connect, you have your followers, you can have a live event, record your fair. So it's a great channel for that kind of visibility. Then we have Twitter. It's a fast-paced online news and social networking platform. It's a way to share simple and fast content. In fact, your messaging has to be very limited, but it's something that quickly people can read and take action. So it has its pros. And the use of hashtags is very popular. So hashtag flu, hashtag vaccinate now, right? It can help your messaging to make it stronger. Then we have Instagram, which is focused on sharing images and videos specifically, right? It offers also the story, which is a short video content. It supports live streaming as well. And also you can use your hashtags. Then we have YouTube, right? We all know YouTube. We have kids, we know YouTube as well. They're always watching it. So it's a platform that has billions of videos of any given topic. And this one can help you because a health center can have their own channel, library of videos. You can do blogs. What do we do in a health center? You can do educational videos, etc. So opportunities are endless. So I recommend you to go and read more about it. And then we have WhatsApp. And this one, to me, is a new one as a social media, right? It's an important one that a lot of health centers are integrating to expand their education to their patients and communication. So it's a messenger application for smartphones that uses the internet for messages or calls, specifically for ag workers. It helps them connect with family and friends that are abroad because they only need the internet. So it is a free services, and it supports sharing information to one or multiple people at once. So let's say that we have a health fair, we want to send a flyer, we can just send it through there, they receive it, and they can chat with you at what time, where it is, so you can have that kind of communication with them. And last but not least, we have TikTok, one of the fastest growing right now, very popular, mostly among the young population. It supports quick video content, and it is a great platform to collaborate with other organizations because you can react, you can stitch videos, you can answer to them, share their content, etc. So there's more to learn about this. Again, I recommend you to go and download our social media toolkit to read more about it. So without no further ado, I want to pass it to my colleague Alexis, who now will continue talking because we're not done with Saludes Vida Health Center here. He's going to continue talking about, okay, so now we've recommended all these things. How can they evaluate what they're doing and see if it's working? So Alexis, I will pass it on to you to continue helping Saludes Vida Health Center.
Perfect. Thank you, Esli. Okay, we go to the next slide, please. So now, like Esli mentioned, let's talk about how Saludes Vida can evaluate those social media efforts or those outcomes. And now that Saludes Vida have identified objectives, they have been selecting which goals or establish their goals, what are the activities they want to what to do, and the communications that they want to create, delivering these different social media outcomes. We want to see how can they measure their success, their challenges, and how they can redo, or how can they reflect about which are the best publications, best communications, and the best channels that they can use. So we go to the next slide, please. You will see here, again, our scenario, Saludes Vida needs to evaluate their effectiveness of their efforts to measure their reach and brand recognition at their 3-month mark. So they should review their likes, reactions, shares, impression, etc., to assess if what they have been doing so far is working, or if they need a new strategy to be put in place. So as you can see here on the right side, we have a couple of icons that I'm very sure you're familiar with. So we want to ask why Saludes Vida needs to evaluate social media metrics or outcomes. So depending on their outreach on social media goals, Saludes Vida need to assess the type of content that resonates the most with their audience, in this case, farm worker populations. So higher engagement publications get to larger audiences, which expands their reach as a health center. More people will hear about them, so that more people will start to interact with them and go to their web pages, their social media platform, etc. So they need to determine what is called the return on investment, sorry. So this is a measurement of the patient's interaction or input that coincides with the social media campaigns, activities, publications, or in simple words is what the patients are talking about when they're seeing this health center publications in their platforms. So Salud es Vida can track activities by likes, and this is liking a post, which is done by just clicking on this icon, the thumbs up. So each click is shown through this icon, as I mentioned, and is displayed with a total amount within the post. So as you will see the thumbs up icon, and then you will start seeing numbers, and that will mean that that amount of people like this publication. We also have this new icon that started no long ago called reactions. And these reactions are different icons that convey some kind of emotions. And here we also have the like, but we also have love, we have the wow reaction, we have the sad, the angry, and etc. So they are selected by the user, and they are displayed with a total amount of numbers again within the post. So these new reactions emulate what are their the emotions, what are their emotions when they see this post. This post could be a little bit more funny, it could be surprising, it could be publications that kind of like reach out or create some emotions or some sadness, which can also create some other rougher emotions. But depending on what kind of information, what kind of content you share with the audience, you can create different emotions within the population. And then we have the shares. Shares also, users can share an entire post from another page as their own, or through other web page or through other websites profiles. So these can be done as a post. You can share their publication as your post, but you can also share that as a direct message to another person, to a group, to another organization. You can also share these publications through email, or you can just copy and paste their website link. So the total number of shares is also displayed on these posts. So you can see there the comment icon, the share, and the send, and these are impressions, engagement. These also measure the engagement that your website or your platform have. So based on Salud es Vida activity, they can gather the metrics, those metrics, and they will give them the following. So impressions will give them the number of times the content will be displayed in other profiles, the engagement, the number of interactions of the content that receives from user, how many users are liking their posts, are commenting with them. You can also increase that engagement through the comments, responding some questions that they may have about the topics, in this case vaccination, but also through the shares, how many people save your publications, among others. And the reach is the number of people who are seeing your content. But also social media outcome metrics can help Salud es Vida to measure their program or project goals and objectives completion. They help you know if your efforts, if your communications, if your messages are being productive or are being successful. So this metric will provide information on what are the most effective type of publications, which audience interact more with your publications or your post, and also will help how to evaluate the effectivity and the reach of these activities if you create a vaccination campaign or any other publications. So as you can see, a lot of these new features on web or platforms, and each of these social media platforms have their own, but these are the most common. So Now that we talk about evaluation, I want to share with you, we go to the next slide, some strategies that are included in this toolkit, and you will have access to them. Some of these strategies to increase that social media impact. So if we now go to our next slide, we can see how Saludes Vida are implementing these strategies. And I want to showcase the first appendix that we have included here in our toolkit, and we have adapted to help Saludes Vida improve their social media impact. So Saludes Vida Health Center should take the following considerations when they're creating social media content. And we have here an example. As you can see, we created 3 different social media posts using Facebook, Twitter, and now Instagram. We added one more social media so you can see how these publications or how these messages can be um, uh, adapted depending on what are the features or the limitations of these social media platforms. So very important that all of these publications use plain language. As you can see here, we use or we created these 2 social media messages in English, but also in Spanish, because again, our population or targeted population are farm workers, and a lot of those farm workers, their main language is Spanish, but we also want to have this same message in both languages. It is very important that you tailor your message to the target population. And you do this keeping in mind the needs of your agricultural worker population. You need to use terms that are related to their culture and the day-to-day language that they use, and adapt those messages to low literacy. It is also very important to use visuals, use or develop images that are representative to the ag worker community, but also relevant to their culture and the topic that you want to share with them. And as you can see here, we use an image of a person getting their flu shot, they're getting vaccinated. So publications with visuals are easier to understand, and they engage a little bit more with the patients than text-only publications. So it is very important to use images, graphics, even videos when sharing a message. Also, we want to promote calls to action, use active voice when you are creating messages, and this indicate what action steps they need to follow. So as you can see here, we're engaging, or we are um, trying to make them get vaccinated. So we say on this publications, you could see that in all of these messages, we say we want you healthy, get vaccinated, lo queremos saludable, vacúnese. We are giving them what kind of action they need to do to get that flu shot. Um, Again, and then after we use visuals, we promote calls to action. We want also to share with them some relevant content. And we do this by sharing, for example, some links to additional information. If they want to know more about, for example, these messages that include flu symptoms, if they want to know where to get vaccinated, we can also include links to more information where they can find all of this additional publication, that because again, the limitations or the features available on these platforms, we can add all of that information. And the last step that we also want to, and Saludes Vida to take in consideration, is to ensure that their staff is capable of interacting with all of this information. We want to increase the digital literacy of your staff. This way they can use the platforms effectively with creating, for example, flu-related content for the population. And we want to cross-promote with other partners. We want to invite other health centers, other organizations that are related to, or they work towards vaccination efforts, to partner with Saludes Vida to help them spread their vaccination prevention messages and initiatives. So this is the first example that we have. If we go to the next slide, we're going to see another example of what another strategy that Salud es Vida can use to showcase cross promotion with partners. And this is a very simple example. This is an email invitation that Salud es Vida is doing to invite other organizations or partners, advocates, to help them create this social media messages. So these email communications have, I'm not going to go over all the details, but there are some key information or key content that need to be included. So for example, you need to start adding who you are. You need to know, or you need to include, what is the subject of this partnership invitation? What is the message? What do you want to do by this invitation? In this case is Salud es Vida would like to invite, or would like to partner with your health centers to cross promote social media efforts to increase that vaccination reach, or that vaccination awareness within the populations that Salud es Vida, but also their partners provide services. Also, we want Salud es Vida would like to detail about, what is the initiative that they're doing? What is this campaign or this vaccination awareness efforts that they are promoting, or they're putting in place? So here you would like to list some of the activities that are linked to the campaign or to the awareness messages, and you would like to, write down what are all the actions that you are going to do, or you would like to do within these partnerships. And you also want to share with them what are some ways to get involved with this within this email invitation, this partnership that you are sharing with them. And also, create like a formal process of partnership approval. You will also want to ask them, hey, how can we officialize this partnership? How could we have this partnership put in place? So you can ask them if this is, do you need a point of contact? Do you need a memorandum of understanding? Do we need to create an agreement within different organizations just to solidify that that partnership? So this is a very simple email invitation. You will find a template also in the toolkit that we are sharing with you. And then we will move to the next slide, please. We're going to share the last uh, strategy that you can use. And this is a very simple customizable flyer that you can also create with your partners to showcase that cross promotion within your partners and the activity that you want to do. And this is very example. This is a visual element that you are going to include with your social media publications, and any other activities that are related to the vaccine awareness. So these visuals are to promote those partnership efforts, and they need to include what are the partnership topics. As you can see here, the titles say, "Together we can stop the flu virus." So, and now we know that this publication, this flyer, is related to the flu virus. So you need to name what is the initiative or the campaign. In this case, is a 2022 flu vaccination awareness campaign that Salud es Vida would like to create or promote with their partners. Also, Salud es Vida would like to use flu-related pictures or graphics. And you can see here, they just use a very simple image of the flu vaccine, and also like a syringe, try to do or relate, try to relate that to the vaccination efforts. Also, Salud es Vida would like to detail social media activities. And you can see here in the little square that they write down what are the objectives of this campaign or this efforts, what are the activities that they're going to do, and what are the dates or the time frame. So it is very important that you also, create their own activities within this partnership, set up a timeline with your partners, and also have some objectives that are being met with using these activities or creating these activities. And then we have Very important, we need to include the contact information of Salud et Vida, but also the partners that are going to work alongside with them. And you can use email, phone numbers, websites. It's very important that that content information is included in this flyers. And something that we also encourage using now that technology is being used right after the pandemic. So the use of QR codes. QR codes are a very effective way to access information. So you can link using these QR codes, more information, your websites, additional campaign information that can be included in this flyer. So you can always create a link to a homepage or a website where all the information will be included. And very important, last but not least, you also want to include your funder disclaimer. It's very important that any publications, any messages that are related to a funder, if your health center or organization are funded by an outsider or like federal program, an organization, etc., it is very important to add a disclaimer. So here I show you 3 very simple strategies that you can use to increase that social media impact and create partnerships to use these platforms to increase engagement with the patients. Now we're gonna pass it on to Jolene, that she's gonna talk a little bit more about some other strategies and the lessons learned.
Hi, everyone. So we've heard about these strategies. Now we're going to learn a little bit of how they look like in the spotlight and best practices and lesson learned. Now you're going to hear me reiterate some of the points that were already mentioned, and that only means that they are that important. So if you hear it twice, it's important. I'm going to be outlining 3 different key things that we put into practice and the things that we have learned along the way. Some are perfect, some are imperfect, but hey, we're here to learn from each other. Next slide. So I'm going to talk about visuals, kind of really reiterating and bringing that home, that it's good to say this information in images. Graphics tend to be the best way for sharing tidbits of information via text or any other platform that is graphic friendly. And as you can see, those are some examples of graphics that we share with our farm worker community. And we are about branding, which is our blue, which you've seen plastered all over. And that is something of recognition. The blue and the logo, they know this information is health information related. Another important thing with visuals is to think about language access. So one of the things that we know that we have learned is that some folks cannot read, so audio and visuals are better for them. So we try to tailor graphics and visuals to that by translating essential phrases that we want to communicate with audiences and use it in the graphics. So you can see on the graphic in the left, the vacunate, that's actually in Mixteco. We had some, we work with indigenous communities. So we asked, can we translate the very simple, like, it's important to get vaccinated, get vaccinated, it's important, it's your right. And just, getting some graphics with those simple messages just to communicate that, hey, it's your right, here we are, we're trying to access everyone deserves this information. Keeping it simple is another thing that we've learned. As you can see there, it's mostly image heavy and just really highlighting the important things of, just piquing their interest with that. And as it was mentioned before, it's important to be culturally relevant. If you're, trying to focus on workers who have recently arrived from a different country, using images or cultural references that speak to them directly, because there are certain things in the US culture that they might not understand why we're saying this and this. An example of that is acknowledging, herbal practices with indigenous communities and really kind of honoring that. And, how do you accompany the science with that in an image? So that's been really cool to learn and play around with as we think about visuals. Next slide. Another key thing is how you formulate your post. So in the example that you see here, it's a sample message structure with a hook. So what is it that you're trying to to kind of rope people into reading, your descriptor, what is this post about, and your call to action, kind of letting folks, know what you want them to do. Your social media posts should merely be just a hook to draw in the audience to a more detailed source. And when we talk about sources, it's important to also learn or know how to address misinformation, specifically with a lot of health information with flu and then during the pandemic. So it's important to address it without reinforcing the incorrect information, to point to credible sources, and use inclusive people first language. So an example of that is there was a lot of misinformation with the vaccines. People had different feelings about the vaccines. So instead of saying, hey, get the vaccine, it's not true that that this is going to happen when you get the vaccine. Instead, we acknowledge that there are some fears with getting vaccinated, and then affirm that it is good for folks to seek out information, but that the information that is sought out, could come from their clinician or a trusted nurse or a trusted, community health worker. So it's addressing the misinformation without reinforcing the myth, but it's pointing them to a credible source. The next one. And then the last kind of thing that we've learned along the way is posting where people are. Our team to connect with farm workers and the farm worker communities, we mainly use WhatsApp and Facebook groups because that's where we know a lot of them are. It's been key to join different social media groups where farm workers frequent. So farm worker Facebook groups, as you see in those examples, of folks, H2A worker groups on Facebook, and then any tianguis and descuentos, flea market WhatsApp groups that folks tend to set up. Now, with the Facebook groups, it's easy to join. You just request and just be sure not to spam because you can easily be blacklisted. And what I mean by blacklisted is admin can just decide like, oh, you're just posting all, every week about this, like, no, we're going to discontinue your post. So it's about gaining trust, right? It's about getting a sense of what people are talking about, getting to know the admin and say, hey, I'm from so-and-so. We're going to be posting this information just so they can get to know you and approve your messages as well. With WhatsApp groups, though, it's a little bit harder to join because you need to find who's in what group. So a lot of the suggestion we kind of give is to talk to your patients, talk to your clients, talk to the people, community leaders that you know, and ask them, hey, are you in a WhatsApp group? Can I join or use them, right? If they want to be your ambassadors for information, how can a community health worker or a nurse can send tidbits of information through WhatsApp groups? Through WhatsApp, we heavily rely in WhatsApp status as well. You can put an image or a video on WhatsApp status and just leave it on there for 24 hours and people can look at it and it tells you for metrics how many people looked at your resource. And another cool thing about that is that you can link it to your Facebook account, so your organization Facebook account, and whatever you post on Facebook in your stories or your Facebook Live can go into that WhatsApp status, and folks, you can be, connecting folks through those two platforms. So something really nice to know there. The limitations, though, that we have learned about posting in WhatsApp and Facebook groups is the metrics. It's a little bit hard to get metrics for both. But once in the Facebook groups, you can kind of see how many likes, shares, not necessarily impressions, but just the amount of likes and shares and reactions you get. And through WhatsApp, the only metrics you can really get is from the status updates. So just as a limitation, but it's still something worthwhile trying. And the last thing with that is just considering posting times. That has been very important. We know that farm workers and workers in general work long hours and either check their social media early in the morning, late in the evening, or even during their days off, which is typically on a weekend, right, a Sunday. So we always tend to consider posting really early, like 6 to 7 in the morning, and then 6 or 8 at night, or any time in the weekend where we know that they'll be looking. And And yeah, earlier posts have the advantage of being on their timelines for longer throughout the day. So we do consider posting very early to ensure everyone who's getting ready to work can see it. Next one. So with that said, like I said, those are 3 keys and kind of a snapshot into our social media toolkits that we have additional to the Flu one that you have access to today. But we do have a COVID-19 messaging toolkit. This social media toolkit contains resources and information tailored for farm worker communities and to amplify your organization's social media campaign against COVID. It includes a social media guide, media repository to aid in content creation, and talks a little bit more about farm worker media consumption. So if you're always curious, like, what are farm workers, what platforms are they mostly using, or, who's my demographic, we have some tidbit information in that toolkit. And we also have a toolkit on flu, but during the pandemic time, to address specifically people's questions and concerns in regard of getting the booster with their flu shot. So if you have any questions about that, you can refer to that toolkit with a media repository as well, and a social media guide for branding content. And the next slide, once you receive this site, you can see both toolkits linked in there or in the chat as Lee just put there. And now I will pass it on to my colleagues.
Perfect. Thank you, Jolynn. So if we go to our next slide, I think we have finished our first part. So we thank you a lot for joining us. Please, if you have any questions, we're going to have some time to do some Q&A, but we wanted to thank you for joining us to this first part of the webinar.